Welcome ladies and gentlemen. In the last videos we discussed anti-cancer chemotherapy, or you can say chemotherapy for the cancer. Now in this video we will discuss the steroids. As usual, the videos are available both in Urdu and English, so this video is in English. Steroids, we use two types of medications, two types of procedures. Number one, in the body, like steroidal hormones, estrogen, which are responsible for causing the cancer in the females, will give those females the antagonist of estrogen to treat that cancer, and somehow we will take the estrogen out from the body, or will inhibit, so like that the cancer might not proliferate, the cancer might not cause further harm to the body. So there are two types. One is hormone responsive tumor, another one is tumor hormone dependent tumor. So hormone responsive tumor is that tumor in which if hormone is dispensed, that would cause the regression of that tumor, means that tumor will be regressed, will be suppressed, the amount of that tumor will be decreased. You can say the tumor will undergo the process of regression. And another tumor is available, that is hormone dependent, in which what will we do? Either we will go through the surgical procedure to remove that hormone, or we will give the medication antagonist to decrease the effect of that hormone. We'll give you example of estrogen, that is responsible for causing the cancer known as breast cancer. First of all, let us know the basic understanding of the steroids, how the steroids are doing their action, or how the hormone like estrogen is doing its action. When estrogen or steroid enters the body, the cell, the specific cell, so there will be a receptor waiting for that hormone. That steroids or that hormone will then combine with the receptor, then this receptor will become activated. Now this activated receptor with that specific steroid will enter to the nucleus, will be translocated to the nucleus. Inside the nucleus there will be a specific gene which will be then directed for the translation or transcription process to form the protein by means of messenger RNA. Then that protein will be formed. So this protein will be of two basic function. That is, one is growth regulation, which is the first function of that protein, and then is proliferation. This protein will be responsible for the cellular growth or cellular proliferation. So now what we are supposed to do, as it is causing, now it has become the tumor cell, so now we want to stop this tumor cell from further growth and proliferation. We will inhibit the steroids. Suppose we have example of the drug tamoxifen. I am using suppose a lot, forgive me for that. Tamoxifen, it is a drug that is estrogen receptor antagonist. What will this drug do? As receptor is going to be activated by the steroids. When we take tamoxifen, now this steroid or this estrogen will not be able to combine with this receptor. So if a receptor is not going to be combined, not going to be activated by the drug, so what will happen? Then this tamoxifen will combine with this receptor. Now this receptor will be not able to go or translocate towards the nucleus. So if it is not coming to the nucleus, it is not going to form a protein by means of a transcription and translation. Now if this protein is not formed, so then there will be no growth, regulation or proliferation of the cell. Like that, we stopped the growth of this tumor or proliferation of this tumor or these cancerous cells. Then we have raloxifene, which is also anti-tumor, that is acting as steroid. These are the drugs that will act just as like steroidal pathway, which will cause the down regulation of estrogen receptor. Now these drugs, they have a common function, that is like they will either stop the receptor to translocate, and the next step is that they will form the proteins, or they will direct those proteins to target to bring the receptors from the cellular surface to inside the cell. Before we were having the receptors here. Now because of these medications, what will happen? Those receptors present at the surface of the cell, they will start migrating to inside the cell. for the other, either those receptors will be destroyed, or those receptors will stay inside the cell for a longer period of time. So like this, if the receptor is not available at the surface, so then, or inside the cell, they are not active for inactive form. So then, if receptor is not active, if receptor is not available, it means that there is no any site of action for that receptor to get itself activate and to go for the reaction, for the actions. And another one, we have aromatase inhibitor. It is also it is an enzyme which is also responsible for formation of the estrogen extra-adrenal, outside the adrenal gland, in tissues of the skin, of the lungs, of the breasts, of the liver, etc. So there is also the formation of estrogen. So now we discussed that estrogen is a responsive hormone for cancer. So when we block this aromatase, then no estrogen will be formed. This aromatase is actually forming the estrogen by converting androstenedione to estrogen. So if there is no androstenedione conversion towards estrogen by means of aromatase, like this, we will be not having estrogen. These actually happen in post-menopausal women. Those women, though they have crossed the age of 50 or 40, mean they have now undergone the process of menopause, they will not be susceptible for these types of tumors, because estrogen will be also formed in them extra-adrenally. So in order to stop extra-adrenal formation of estrogen, we will give aromatase inhibitors, and raloxifene, tamoxifen, they are actually acting as estrogen antagonist, which are acting inside the cell. And now I will give you a simple example, that is of estrogen, regarding the hormone responsive and hormone dependent. Now hormone dependent is in the females, estrogen is hormone dependent, means because of this estrogen there is the cancer. And in males it is hormone responsive. Why? Because in order to treat the prostate cancer, if you want to treat that prostate cancer, if we give to that patient estrogen, that patient will be treated. Means for prostate cancer, estrogen is causing regression of the prostate cancer. And in case of the breast cancer or any other cancer, especially in females, if we go under the process of surgical procedure or these medications, that will cause hormone